Come in.
So, good afternoon, ma'am. Good afternoon, ma'am. I'm Jessica Valdez from BSN 11, and I will be going to perform the administering of ear medication. So, the purpose of this medication is to treat or sometimes to prevent a bacterial ear infection. So, for our assessment, we need to assess for the following: the client's level of consciousness and ability to follow or understand instructions. So, how are you, ma'am?
I'm okay.
Okay, that's good to hear po. And then next is our client's vital signs. Theoretically po, we already got the pulse rate, the respiratory rate, the blood pressure, and the temperature of the client. And all the result is normal. And then next is the presence of pain in the ear. So, ma'am, may nararamdaman po ba kayong sakit sa tenga niyo po?
Wala naman po.
Okay po, that's good po. And also the presence of ear discharges. So, inspect ko lang po, ma'am. Ayan, okay na po. Wala naman pong presence of ear discharges. And then the intactness of our medication. So, ang ating pong ofloxacin octic solution. Intact naman po ang kanyang ang ating medication. And then the color and appearance of the medication, also the expiration date of the medication. So, as I can see, the medication has a normal color po. And then, expiration date po niya is 2025 po. And then, for our planning, we need to observe the 12 rights of medication administration, especially the 6 rights in medication administration, which is the international standard, that composed of the right client, right medication, right route, right dose, right time, and right documentation po. So, next po is to do hand washing before and after the preparing of materials. And then next is to prepare the following equipment. We have here our hypo tray to hold the needed materials po. And then the prescribed ear medication, also the medication card, which says ofloxacin octic solution po. So, 2 drops based on the medication administration record. And then, sa right ear po ng ating patient. And ito po yung ating medication. Ofloxacin octic solution po. Ayan. So, expiration date po is 2025. And then, our yung pong ating sterile gauze, and also meron po tayong cotton balls, 2 pieces po, and also the sterile gauze po, 2 pieces. And then, 1 pair of clean gloves po, and our pen light po. So, next is our implementation procedure. Perform hand hygiene and put on PPE if indicated. And then, don't forget to introduce yourself and verify the client's identity using 2 identifiers. So, good afternoon, ma'am. I'm Jessica Valdez, your nurse for today. May I know your name, ma'am, please? How about your birthday po?
January 27, 2007.
Okay, that's good po. And, ngayon po, ma'am, is mag-administer po ako ng medication para po sa inyong ear. And then, I will be going to ask you to do some tasks for me. Please do follow my instructions well. Okay, that's good po. And then, the rationale behind this is that this ensures that the right client or patient receives the medication. And then, place the hypo tray in the bedside table. And then, don't forget to provide for the client's privacy and safety, and also for comfort. And then, it includes the proper positioning of our patient, including whether the supine, side lying, or sitting position. So, mas comfortable naman po kayo sa sitting, sa supine position, ma'am?
Opo.
Okay po, that's good po. Also, spread the curtain inside the room or closing the door to provide for the safety of our patient and also for the privacy. And then, also, we need to put a call light where the client can reach it. And then don't forget to put down the side rails where we will work, and then keep the other side rails upward to secure the patient's safety. And then next po is we need to assist the client in a side lying position wherein the lying with the ear being treated uppermost po. So, position po. And then put on clean gloves po. So, nakapag clean gloves na po tayo. And then clear the pinna of the ear or the meatus of the ear canal using a sterile gauze po. So, clean po natin yung pinna. And then, sa ear po, meatus. And then, discard or dispose po the used soiled materials. And then, next is to warm po natin yung medication in between our palms po for 10 seconds or babad lang po natin siya sa warm water. Ganyan. So, since gumamit po ako ng alternative na dropper, lalagay ko lang po siya sa maliit na container and gagamit po tayo ng dropper po mismo. And then next po is straighten auditory canal by pulling the pinna. So, for children po, ipupush po natin, ipupull po natin downward and then backward. While for adults po, ipupull po natin upward and then backward. So, kunin ko lang po yung ano natin. Ito po yung medication natin. Kulang po tayo ng 2 drops po. Okay. So, pull backward po. Pull upward and then backward. And then, next po is to instill na po natin yung correct number of drops along the side of the ear po and the canal. Ayan po. So, 2 drops lang po as based on the medication administration record po ng 1, 2. Ayan po. So, remain po kayo sa side lying position po. And we need to insert a small cotton fluff loosely at the meatus of the auditory canal for 15 to 20 minutes po. But do not press it into the canal. And then, wait for 15 to 20 minutes po. After 15 to 20 minutes po, remove na po natin yung cotton ball and then put it on the container for use materials po. And then, next po is to assist the patient in a comfortable supine position. Ayan po. And then, after that, secure the side rails po where para po ma-secure po yung safety ng ating patient, and then dispose all used materials po on the container. And then remove the PPE if used po, and then perform hand hygiene. Put na din po sa container. And then, assess for the effectiveness of the medication given at a appropriate time frame po after 30 minutes. And then, document the administration done. So, we administered a ear medication. using ofloxacin po. Octic solution. And then, lastly po is to evaluate the patient's response to medication within an appropriate time po. So, thank you po.